Welcome to the Piedmont Tribe Regional Council Area Agency on Aging listening session on the American Rescue Plan Act funding opportunity for mental health counseling. Information on this funding opportunity is found on the PTR website, as well as the application and other documents required if your agency has never received funding through PTRC. This request for application is for grant proposals funded by the American Rescue Plan Act of 2021, also known as ARPA. The PTRC AAA is taking a regional approach in distributing these funds based on priorities established by the North Carolina Division of Aging and Adult Services. Service match funding is not required, and funds will remain available until expended or until September 30th of 2024, whichever comes first. The project period for this funding is November 1st of 2022 to September 30th of 2024, and all ARPA funds must be obligated by September 30th of 2024. PTRC AAA is making 4 ARPA mental health counseling mini grants available in the amount of $75,000 each to provide mental health services to those aged 60 and older or to the caregiver of someone 60 and older, regardless of income, in the following North Carolina counties: Alamance, Caswell, Davidson, Davie, Forsyth, Guilford, Montgomery, Randolph, Rockingham, Stokes, Surrey, and Yadkin. Under the ARPA mental health counseling mini grants, agencies may provide one or more of the following services: case consultation, evaluation, and outpatient treatment. Please review the RFA for specific examples of allowable services under each of the categories listed. This grant does allow for awardees to travel to the homes and clients to provide the services, with an emphasis on older adults that live independently in their community. The allowable expense categories for the ARPA mental health counseling mini grants are administrative cost, cost of mental health counseling services, and PPE and other consumable supplies, with no more than 5% of the total grant being allowed for this category. The project period for the ARPA mental health counseling mini grants is November 1st of 2022 to September 30th of 2024. The reporting requirements for the ARPA mental health counseling mini grants are as follows. A client registration form must be completed for each eligible participant receiving the services. In order to maintain accurate client data, agencies must conduct an update of these forms for persons receiving outpatient treatment services every 12 months. Agencies providing the ARPA mental health counseling will maintain at a minimum a log of case consultation and evaluation services provided. This log shall include at a minimum the following information: client's name, client's date of birth, identify how the client meets the eligibility requirements, the type of service the client received, the dates of the service, and indication that the dates of service on the invoice match the dates of service on the log. Agencies providing the ARPA mental health counseling will maintain a client record on all persons receiving outpatient treatment services. To apply for the funding for the ARPA mental health counseling mini grants, 3 copies of the request for application, all with original signatures, must be submitted to the PTRC AAA at 1398 Carrollton Crossing Drive in Kernersville, North Carolina 27284. Attention, Gwen Shields. These are due by October 14th, 2022 at 4 p.m. Applications received after this date and time will not be considered for funding. Agencies may apply to provide the service in more than one county. However, each county requires a separate and a complete application. A scoring tool will be used to evaluate these applications. Be sure to answer all questions describing your approach. The tool will be available on the PTRC website. Priority consideration will be given to the proposals that address the needs of older adults. PTRC AAA reserves the right to reject any or all applications, waive technicalities, and to be the sole judge of the suitability of the services for their intended use, and further specifically reserves the right to make the award in the best interest of the PTRC AAA regional program. Upon award of the ARPA Mental Health Counseling Mini Grants, funded agencies must comply with the North Carolina Division of Aging and Adult Services Mental Health Counseling Service Standards, monitoring, confidentiality and security, record retention and disposition, and the project timeline. The ARPA Mental Health Counseling Mini Grants do have staffing requirements. All services shall be provided by a qualified professional as defined in the North Carolina Administrative Code. Please review the RFA for specific examples of what a qualified professional is. The ARPA Mental Health Counseling reimbursements will be handled through the state's Aging Resource Management System on a monthly basis. Reimbursement is dependent upon accurate reporting of service data. The timeline for the ARPA Mental Health Counseling Mini Grants is as follows. The funding availability announcement and the information session, which has been pre-recorded, will be released on September 23rd, 2022. The final day to submit questions is October 7th at 4 p.m. Applications will be due on October 14th at 4 p.m. and the award announcement will be in early November of 2022. To review what we have discussed so far, there will be 4 mini grants for the ARPA Mental Health Counseling Program of up to $75,000 per grant. The period for this funding is November 1st, 2022 to September 30th of 2024. An agency can apply to serve more than one county, but each request requires a separate application. 3 copies of your RFA with original signatures must be submitted by the deadline. Funding requests must be reasonable, necessary, and justifiable. Additional information and the request for application will be available on the PTRC website under the American Rescue Plan Act Regional Recovery tab. This concludes our listening session.